I started working at the ferry and ended up being a captain and really liked the job. But it was endless days and endless shifts, back and forth, 8 hours, and I started ballooning with the weight because I was less active. My A1C was going up and up. The more weight I gained, the more insulin I had to use. The more insulin I had to use, the hungrier I got. It was just a vicious cycle. My doctor, she told me, point blank, if you don't do something with your lifestyle, it's going to kill you. Well, after I got injured at work, I was disabled. My deductible was $5,000 a year. I couldn't afford $5,000 out of my pocket for insulin, so I was making a vial last 1 month. I should have been going through 3 or 4 of those and looking at, well, I guess all I'm going to do is now wait to die. My doctor retired and she referred me to Dr. Wheeler, and I told her how I felt about life and everything and my health and how the care I wasn't getting. And she says, we're going to do something about this.
When we started rolling out this newer team-based approach here, one of the things that came with that was case management. I remember getting messages from our care management nurse.
So the care team really swooped in and said, we have to help Jim. We have to figure out what is going on, get to the bottom of what these barriers are.
Before this model, really, it was sort of episodic care. There really wasn't a team that was built around the patient. Now we really have a robust team for patients to interact with their care managers. So they can tell them all of their questions that they have or any barriers that they might be hitting, and that care manager can really help navigate the system. He used to have insurance and he used to have insulin, and then he lost his job, he lost his insurance.
So with care managers, we were able to go in, assess, where are you at, Jim? What do you need? What do you have access to? What do you need access to? And we were just breaking down barriers.
The pharmacy has this program for medications. If you just send these prescriptions to the UVM pharmacy, then we're going to get them filled for him.
We know what's out there in the community, what you're eligible for, what we can connect you to.
Oh, now he's on, the insulin he was on before when he had good health insurance. He now has this continuous glucose monitor that he's using. He's lost weight. He's feeling better. It's really kind of a 180 when I see him in clinic now.
I won't say, oh, geez, I'm the healthiest guy in the world. I know I'm not. But I'm healthier than I was, say, 5-6 years ago. I'm like, you can't even psych night and day. There was the little lump of Jim that was on the road to death, and here's the Jim that's got some positive attitude, feeling healthy, losing weight. It's such a wonderful feeling to wake up in the morning and know your blood sugar isn't 300. You just feel so much better.
We didn't hopefully only impact his health, but also his outlook on the life that he has. To really flip your life around where you're looking at your life in a whole new way. I mean, I think from where he was, to make that kind of a change is nothing short of a miracle. Not only do I have resources for me, if I have a question around a medication, I can go ask the pharmacist that I work with. My patients have access to that resource, and it is really exciting time to be practicing medicine and be able to offer this team-based care to my patients that is very different than the care I was delivering even a couple years ago. It's a win for patients, it's a win for the system, it's a win for providers.
I was amazed. They got it done, and they got it done in a short amount of time. And that is what I am so thankful for, is because I saw the effort they put into it for me. I was going to do the same for them.